Hello, Dr. Shibu. Welcome to the Health Trips interview series. Could you please introduce yourself for the benefit of our viewers?
Hi Roshan, I'm Dr. Shibu Pillai and I'm primarily a pediatric neurosurgeon. Although I do deal with patients who are adults too, but I prefer working with kids. I've been trained in neurosurgery at the National Institute of Mental Health and Neurosciences in Bangalore, which is a reputed national institute. Subsequently, I've also done fellowships in pediatric neurosurgery and neurotrauma in Vancouver, in Canada. And since then, I've been primarily working with kids here at Narayana Pediatric.
Thank you.
I had the fortune to work at NIMHANS after my training and was involved in training neurosurgical people there, neurosurgical students there.
Sure. So could you talk to us a little bit about the kind of patients you treat and for what conditions?
Yeah. Basically, pediatric neurosurgical patients, I guess you could broadly fix them into 5 categories. The first would be those who are born with problems, that is, they have a neurosurgical problem which arises within the mom's uterus. So those are the congenital kind of problems. Those could be defects in the spinal cord, and so such kids would be born with swellings on the back or with abnormalities along the spinal cord and would result in difficulties in moving their legs or control of their bowel or bladder. Or they could have congenital abnormalities within the brain, such as collection of fluid within the brain cavity, which is called hydrocephalus. The other thing which they could have while they are in uterus is a kind of difficulty in the normal development of the brain, which can lead to condition which is called cerebral palsy. This kind of cerebral palsy can also develop soon after birth as a result of bleeding into the brain cavities and the subsequent delay in the normal development of the brain. Children with cerebral palsy can have great amount of stiffness of the hands or legs, and as a result they have trouble walking or using their hands, or even have difficulty in speaking. So this is one kind of set of problems. The other set of problems would be those who have tumors either in the brain or in the spinal cord. So a child with a tumor in the brain could come with headaches or with frequent vomiting, or they could just have something as innocuous as slight difficulty walking, a tendency to fall frequently.
Okay.
So such kind of innocuous problems could also be a manifestation of a brain tumor. A third category would be those kids who have epilepsy. Not all kids with epilepsy or seizures or fits need surgery. Sometimes we find that there are children who have fits which are not controlled with medications, which are always the primary treatment. So if over a period of about 2 years with several medications tried, we find that seizures are continuing and are frequently interrupting their normal life, then we evaluate them to see if there is a specific area of the brain which is leading to this kind of epilepsy. And that particular area of brain can be operated and removed.
Okay.
That is called the epileptogenic focus. That focus, once it is removed, we can have significant control of the epilepsy.
Okay.
And the advantage of this is that seizures, if they are left uncontrolled, can over time lead to a decrease in the intelligence of the child.
I see.
So progressively, with uncontrolled seizures, you have problems developing over years. So it's better to deal with this early. If you can treat it surgically, that's the best option.
Sure. So for parents, what are the signs they should be looking for in their children?
Signs could be, for the congenital things, it could be as simple as a small tiny swelling on the back, could be a tuft of hair on the back, could be a dimple, a small tiny hole along the spine, or it could be a change in color. They may have small nodules all over the body. They may start walking, but after some time there is a sort of slight tendency to fall or sway to one side, or it could be that they start walking late, they don't catch up with their peers, intelligence is not as good as normal, or the head size increases compared to their friends. So all these could be signs, telltale signs that something's going on inside. One thing which is often missed in kids and which is unfortunate is that children don't often complain of having decreased vision, and so the only way you may know is that they may try to go and sit in front of the class or their other classmates, or they may bring their books very close
to the eyes.
So vision is something which children don't realize, and parents also not aware of this change over time, and we tend to miss that, and children often come with us almost close to being blind.
Oh, I see. Okay.
So that's a very unfortunate thing which if we pick early can be reversed.
Okay. So I'm guessing you receive a lot of international patients. So which countries do these children usually come from?
Yeah, there are several kids who come in from Middle East, Africa, Nigeria, particularly Kenya.
Okay, sure. Given these are difficult surgeries, according to you, what are a few complications that could arise during such a surgery?
For example, with brain tumors, especially those which occur in very important areas, you could potentially have some difficulty swallowing. Children may see double vision, or they may have trouble walking, some weakness of the hands or legs. Those are the kind of problems which can
occur after the surgery. Sure.
But most often, because of the ability of the brain and spine in children to adapt, called plasticity, very often kids over time with rehabilitation, physiotherapy, they
overcome. Okay, thank you. So, I mean, to quickly end, what advice would you have for parents of children who need to undergo such a surgery?
I would say if you have any doubt regarding the progress in the development of your child, consult a pediatric neurologist or a neurosurgeon immediately, so that a problem, if present, can be identified at its earliest and treated accordingly.
Thank you very much, Dr. Shibu.